Okay, welcome back to today's webinar on laser acupuncture treatment, fundamentals and clinical applications. My name is Dr. David Kanashko. I'm the Director of Education, Training and Research here at Meditech International. We manufacture Bioflex laser therapy devices as well. We have North America's largest outpatient clinic here in Toronto. Using low-level laser therapy or photobiomodulation. And just a bit of housekeeping here before we get started. I want to make sure that everyone can hear my voice. It sounds like everyone can hear me, so I think that's good. Just type in that you can hear my voice and you can see the visuals okay. All my webinars are recorded so that if you want to watch the webinar again for whatever reason, you can do that. We'll be sending out an email within about a week or less, and that email will have a link to this webinar again, just in case you need to leave or want to watch it again or what have you. Or in the future, if you want to listen to a webinar and you can't make it live, then still register and you can actually watch the webinar at a later date at your convenience as well too. So it looks like everyone is able to listen in and see me, which is good, or not me, but the webinar. A bit of background before we get started. I've been involved with low-level laser therapy for over a decade now. I've been practicing as a chiropractor and also trained in traditional Chinese medicine and acupuncture since 1992. So that's making it a fairly lengthy period of time. My main focus and practice now is, of course, photobiomodulation or laser therapy. My goal today is not to train everyone how to do laser acupuncture. My goal today is, in fact, to let everyone know that's interested that what the fundamentals are of laser acupuncture, how it may differ or be similar to the practice of low-level laser therapy, how you can adapt this into your practice with more training. I won't get into a lot of equipment, that's not really my goal, but I do want to talk a bit about what you should try to accomplish with your equipment, wavelengths and power, those kinds of things as well. But don't think that just watching one webinar you can start doing this, because you really should get properly trained and understand the principles obviously of acupuncture. That would be number one. So I'm assuming that you would know acupuncture. But number two, understanding about photobiomodulation. So it's different and similar to needle acupuncture or electroacupuncture, which I've practiced as well, obviously. So let's get started. What I'm going to do today is go over the fundamentals of laser acupuncture, describe what it is, and so forth. Then the bulk of the lecture will be reviewing some research, specifically randomized control trials or some clinical trials, so you can have an understanding of what has been researched and some of the clinical applications that has shown positive results. So you can start to see how you might incorporate this into your practice. Then I'll do an overview and recommend sort of what you might be looking at with respect to some of the parameters to do laser acupuncture, how you can incorporate it into your practice. I'll always have time for questions and answers. So what I'm going to ask you to do is to type in your questions as we go along. I won't answer them right away, but I will answer them at the end of the webinar. So I'd appreciate that if you type them in as we went along, so that by the time I get to the end, I can actually just start to open up the questions and attempt to answer them as best I can. All right, so let's delve into laser acupuncture. Sometimes you'll see the acronym LA. There's no official designation for it, but I might use LA from time to time. It was credited to a medical doctor, Frederick Plog, who is a German-Canadian, that's a Canadian link here. He actually is German, but he spent a fair amount of time in Canada, and he pioneered the use of lasers and acupuncture. He actually built the first manufactured system. I think he called it the Acuplaser system plug. I don't know, that's the name he gave to it. I couldn't actually find any pictures of it online, But that was the first commercial system you could actually buy back in the day. So he was one of the pioneers to start to use lasers for acupuncture. Right around the same time in the 1970s, not really well known, but certainly in Soviet Union, laser acupuncture was starting to be used as well, along with other methods of low-level laser therapy. And there were anecdotal and case studies being used for asthma and hair loss, hypertension, some neurological diseases. So right around that time that Plog was using his devices in Canada and elsewhere in Soviet Union, they were using it. And also in China in the 70s, a little bit later on in the 70s, a well-known physician, he was actually an anesthesiologist, Zhu, was also using laser acupuncture for different procedures, especially surgery for anesthesia, which is really quite interesting as well. So lasers can be used to stimulate acupuncture points, basically using the same rules of point selection as you would with needle acupuncture. However, you're using low intensity non-thermal laser radiation. So laser acupuncture can be used just on its own, or you can combine it with needle acupuncture over the given course of the treatment. The definition, I'm going to go to the World Association for Laser Therapy. So those of you who are new to laser therapy or don't even realize, there is a World Association. So if you just Google WALT, W-A-L-T, and laser, you'll come across their site. They actually have parameters specifically for laser therapy, not parameters for laser acupuncture, but many of the clinicians that do laser therapy also do laser acupuncture. So they've defined it as photonic stimulation of acupuncture points and areas to initiate therapeutic effects similar to needle acupuncture and related therapies, with the benefits of photobiomodulation, which is the newer term for laser therapy or low-level laser therapy. So that's the definition I like to work with. Laser acupuncture is actually quite rapidly developing discipline, especially with respect to the growing research. It's inherently safer, obviously, than needle acupuncture because it's not invasive, and you can use it to stimulate difficult points or difficult to get at points, whether it's on the ear. I used to do some auricular acupuncture in the day, and one of the risks of auricular acupuncture with a needle is infection, because cartilage doesn't have good blood supply, and you have to be really careful about that as well. So this might be an interesting option for those of you who do or delve into auricular acupuncture or sensitive areas. I don't need to describe those. If you do acupuncture, you know that there are sensitive areas where there might be risk to damaging sensitive areas in the body, or in fact even just patients not wanting needles in those areas as well too. So there is some controversy with respect to the mechanisms of laser acupuncture. Obviously, it's not a mechanical stimulation, and it doesn't necessarily share the pain modulation pathway that you would associate with traditional needling acupuncture. So rather than producing qi, which of course everyone that does acupuncture knows as a needling sensation that is felt by a patient, and of course as an acupuncturist, that's one of the goals, is to try and achieve this qi while you're treating. Lasers tend to stimulate an area and try to elicit a physiological effect at the cellular level. I'm going to describe this in brief today. And this is more based on the water principle of photobiomodulation. So a key point to determine the effectiveness of laser acupuncture is dosaging. So there are no specific guidelines for dosaging in laser acupuncture. If anyone says that there are, or it says here's what you have to do based on research or anything else, it's not really accurate, because there's not enough information yet for us to have good guidelines. It's really more subjective, based on clinical experience. I've been doing it for 10 years or longer. Our company's been involved with it for 30 years. I think we have a pretty good handle on dosaging. But again, this isn't from research. This is from clinical experience. So laser acupuncture's early development was influenced, especially in concurrent with research done by a medical doctor in Hungary called André Mester. And André Mester initially did some work with wound healing and lasers, and subsequently tissue healing and pain relief as well. So he's really considered the foremost kind of grandfather, you might say, of laser therapy. This is one of his experiments back in the day. And so what you're seeing here are two skin flap wounds on the bellies of rats. On the left, it's a control. So no light was irradiated on these wounds. And you can see there's two different sizes of wounds here, okay? Now the same rat was treated with red laser. So it basically would be looking like a laser acupuncture over the wound to the left. And you can see the wound to the left was treated excuse me, with red laser light, and over the same time frame compared to the control, you can actually see that this wound is healing much faster than the control. What's really was interesting to note is Mester also noticed that the wound on the right side, you can see here, and then the wound on the right side was also healing faster. Now remember, this wound was not touched with the red laser acupuncture or the laser needle, yet it was healing faster. So one of the things I always impart when I'm doing these lectures is that there's two types of effects of laser therapy. One is direct. So if you're doing laser acupuncture or laser therapy, you're going to have a direct effect of the light, of the photonic light on the cells and the tissues. However, what's really fascinating is that you also will have an effect on blood, which of course is mediated and carried in the circulatory system, and that can have a profound effect around the adjacent area that you're treating. So it's also really important to treat and have a systemic effect as well with laser acupuncture. Generally speaking, here at Meditech, we combine a systemic effect first and then do the equivalent of laser acupuncture or using a laser probe to initiate direct effects on the tissues. So yes, this looks a little scary, but basically what I want everyone to understand is that when you shine red or near infrared light at skin, it will have an effect on different photoacceptors. And you'll get interesting effects, chemical effects, everything from nitric oxide being released to ATP production being increased, to the sodium potassium pump being increased, to a small spike of reactive oxygen species or ROS, which activates an enzyme called nuclear factor kappa beta. And the calcium ion channels may also be affected as well. So all these things are going on when you're shining this light on the cells and the tissues. So when it comes to penetrating the skin, well, obviously needles can penetrate the skin, but does light, like how far does light go, or does it even go through the skin? Well, this is challenging because skin obviously is multi-layered. The tissues are inhomogeneous, anisotropic, which is sort of a property of the molecules. And the optical properties of skin and tissues is very complex. And generally speaking, what you can say is that as light goes into the skin and the tissue, it decreases exponentially as it passes through the skin, and it's wavelength dependent. Okay, so this is really critical because the last thing I would advocate is using wavelengths that aren't known to be effective and can penetrate. So blue, violet, green. You may see these sometimes in laser acupuncture, but if you understand the properties of physics, those wavelengths are not really going into the body at all. It's one thing if you're actually penetrating the skin with a needle, fiber optic needle, and using those wavelengths. But if you're using on the surface of skin, it's not going to really have any dramatic effect with respect to photobiomodulation. Now, in the ultraviolet and visible spectrum, that is between 400 and 600 nanometers, This light is heavily absorbed by hemoglobin and melanin, and therefore has very limited transmission through the skin. And alternatively, much higher wavelengths above 1,000 nanometers. This is the wavelength associated with water. So the light's now being absorbed by water, and again, will have very limited transmission into the body. So in contrast, red wavelengths and near-infrared wavelengths are the ones that tend to be used for laser acupuncture. That's because they're absorbed less and the transmission is greater. To explain this, I won't go into this really in depth, but essentially what you're looking at here is one of the photoacceptors, the main photoacceptors in the target of laser therapy or even laser acupuncture, and that's cytochrome C oxidase. It's an enzyme in the mitochondria. Now, if you're using wavelengths between 500 and around 600 nanometers, this is where you'll see that it's highly absorbed by blood, especially the hemoglobin. So in these wavelengths, green and orange and blue and violet, these are being absorbed by melanin and hemoglobin. However, as you start to get longer into 630, 640, 650, 660, up to around 680, these wavelengths are less absorbed by hemoglobin and therefore are more able to stimulate this enzyme. So these wavelengths tend to be quite good. Now, the issue, of course, is they're still absorbed to some degree, so they don't penetrate very deeply. So red wavelengths are excellent for superficial acupuncture points. And if you studied and you understand acupuncture, you know that when you needle, for example, you're needling at different depths to achieve the chi. And of course, those depths will vary. Some are superficial, some are deep. When I used to do a lot of acupuncture and treating some points, some gallbladder points in the buttock and so forth, the needles would penetrate inches into the tissue, right, to get chi. Well, if you're using red, you're not going to get that deep. However, as you go farther along the wavelengths, if you go above 1,000, you're going to be absorbed by water. However, if you use in the near infrared, which is roughly this peak here, 780 to 900 nanometers, you will in fact go much deeper because it's less absorbed by hemoglobin. So if I'm going to go after some deeper acupuncture points, like the ones I've mentioned to treat sciatica, for example, in the gluteal region, I want to use infrared. That's because it will penetrate much deeper. So acupuncture points are considered to be located at obviously these certain depths, and these depths are really important. So again, as a review, you're going to use red and infrared to reach either shallow or deeper acupuncture points. Different types of laser acupuncture equipment. This is what we use here. For example, there's taping lasers, there's needle lasers, all sorts of different types of lasers out there. They can be very expensive. Now, depending on the power of your output, you may have to have it on the spot for a long time, in which case you'd have to actually have it in a stationary spot, which is what these are showing. But if the power is quite high or higher, then you can get away with just holding it using your hand for maybe 10, 20, 30 seconds and moving to the next point, and not leave it on the skin as long as these other ones. Okay, research-wise, well, it's interesting because I really like the research and it's fascinating to read the research. And believe it or not, there is a growing amount of research on PubMed for laser and acupuncture. I did a search just the other day, and if you use the Boolean indicator search laser and acupuncture, you'll come up with well over 1,000 referenced peer-reviewed publications. So that's a fair amount. So now when you talk about is laser acupuncture effective, is it doing something similar to needle acupuncture? And if you've studied acupuncture and you've looked at the research, you know that when you stimulate certain acupuncture points, you'll actually get a stimulation of the cortex of the brain. And so they've done that kind of research for laser acupuncture. This is one example. This specific one dates of 2002, and they did functional magnetic resonance imaging, and specifically they were stimulating the left bladder 67, that's on the baby toe, on the little toe, and they were also using a placebo, or they call it a dummy acupuncture, and they wanted to see if there was any lighting up of areas of the brain. Here's the point, bladder 67. And on the left, they found that when they did the functional magnetic resonance imaging, stimulating with light on bladder 67, they actually found a certain Broda areas of the cuneus of the brain lit up. So Brodmann area 18 on the medial occipital gyrus, and Brodmann area 19 of the ipsilateral visual cortex lit up. So it's interesting that they found that the placebo did not, of course, light up anything. So there you go. You can stimulate acupuncture points and have stimulation similar to a needle acupuncture. It's just that the way you do it is a little bit different, right? So they actually demonstrated that laser acupuncture specific to certain acupoints actually activated these visual brain areas. Some other research, this particular one looked to see and compare acupuncture sites using traditional needle acupuncture and laser acupuncture. And they were looking specifically at arterial pressure and peripheral circulation of the lower limbs. So they looked at 40 individuals. 20 were stimulated with red light, that's 650 nanometers. They give you the joules, the energy. And the other ones were stimulated using systemic acupuncture needles. And they analyzed this, the peripheral circulation. They were looking at using a sphygmometer and Doppler equipment, checking the pressure. And what they found, interestingly enough, was that only those treated with laser acupuncture exhibited a significant increase in systolic pressure of their lower limbs. Actually, there's some research, interesting research on hypertension and low-level laser therapy. Another randomized, I'm going through these pretty quickly, guys, because I didn't realize this is taking me a long time to get through all this information. There's so much. This particular one looked at bedwetting or nocturnal enuresis in children, the ages 5 to 15, 45 children. They either received a drug or a drug with acupuncture or a sham acupuncture and behavioral therapy. And they also looked at the results 3 months after the study. They were treated twice weekly for 3 months, so a significant amount of treatment, obviously. You can see the wavelength. They use near infrared, and these are just the parameters being used. And the points that they used, everything from spleen, 6, urinary bladder in men. Those of you who do acupuncture are familiar with these points. And this is what they found. There was a statistically significant higher cure rate in the laser acupuncture only group. In fact, it was 73% cure rate, whereas the other groups had a significantly lower cure rate at 20 and 13% respectively. So they concluded that laser acupuncture is a non-invasive, painless tool. If you've ever treated children with acupuncture, you know that even some adults are a little bit queasy when it comes to needles. They may not want to see the needle. Sometimes they're freaked out by it. So this could be an alternative way of stimulating those points in those categories of patients. Another article was laser acupuncture looking at subacromial impingement syndrome in the shoulder. It was a randomized double-blinded controlled trial. 73 patients were treated with laser acupuncture or a sham. These are the points. You can see they were basically around the shoulder, but then some peripheral points. Of course, large intestine 4 is oftentimes done for pain. Again, they used infrared, 850 nanometers wavelength, and they used 100 milliwatts of power. 15 sessions over a 3-week period. They did 5 sessions per week. The treatment group received laser acupuncture, and then there was a sham group, and they all had exercise training as well. I won't show all the charts, but basically they concluded and they found that laser acupuncture, in fact, to both the proximal and the distal points, reduced the pain and improved range of motion and the functional status compared to the placebo group. Another trial looked at temporomandibular joint dysfunction. There were 40 female subjects, different ages of age group range. They all received an occlusal splint in their mouth, and they also received either laser acupuncture or sham. Here are the points, either locally or distally as well. The control group, you would expect every group should receive benefit because they had the occlusal splint as well as having the placebo effect. You can see the control group, the black is before and the shaded gray is after. And of course, the pain when they all started was quite significant. And at the end of the treatment, it was all down to mild pain, so fairly good results. However, if you look at the experimental group, that is the laser group, you can see that, in fact, their pain and their symptoms were basically absent or non-existent. So significantly better results using laser acupuncture and the occlusal splint as opposed to the sham. This was an interesting one. They looked at cerebral palsy in children. They looked at 40 spastic hemiplegic patients, ages 1 to 4, so quite young. This is where needling might be an issue. They were randomly controlled, and both groups received physio for 3 months. You always have to give them a standard treatment. And they may have received laser acupuncture. In this case, they used red, 50 milliwatts, so a significant amount of energy. And it was applied to each point for 30 seconds. And here's the energy density. Here are the points being used. And again, if I'm going fast, you will be able to watch this webinar and stop and start whenever you wish when I send out the follow-up email. So they did a pre-assessment and post-assessment looking at muscle tone, and gross motor function measurements were also obtained and analyzed. And they compared the post-treatment measures, control versus the study groups, looking at significant difference in muscle tone, was in favor of the ones that received the laser compared to the control. So generally speaking, overall, they found laser acupuncture had beneficial effect on reducing the spasticity in cerebral palsy children, and it was helpful in improving their movement. So again, I'm not advocating and telling you, oh, okay, don't do needle acupuncture. I am saying that this might be something that you might want to look at to add to your practice if you don't already do it, or even if you do it, to understand a little bit more about what it is that you're trying to achieve with laser acupuncture. Here's one on osteoarthritis. There are patients with knee osteoarthritis, and they either had active laser or placebo laser, 30 milliwatts of near infrared, 830 nanometers. Here are the acupuncture points being used. They also, this is the first time I'm mentioning Ashi points. That's commonly used as well. Ashi points, if you're not familiar, are just painful points similar to trigger points that aren't necessarily standardized meridian acupuncture points. So the VAS scores showed significant improvement in the active laser group compared to the placebo group at 6 weeks post-intervention and 6 months post-intervention. So that's quite a significant time lag between the treatment and then testing post-treatment. They also looked at the Saudi, this was done in Saudi Arabia, Saudi knee function scale. It also showed significant improvement in the active laser group compared with the placebo group at the last treatment session and 6 months post-intervention. So they concluded overall that the results demonstrate a short-term application of laser therapy to these specific acupuncture points along with exercise helped to reduce pain and improve quality of life in patients with knee OA. An interesting trial on childhood bronchial asthma. So this wasn't a randomized control trial. What they did was they looked at 20 asthmatic children in an outpatient clinic. I believe it was done in Egypt. And they were looking at medication use, their symptoms, asthma control questionnaire, and their lung volume or spirometric values were measured after 10 laser acupuncture sessions, 2 times a week. They did a total of 10 sessions. Here are the points that they used. Again, guys, don't worry about trying to jot all this down. You will be able to look at this at your own speed in the future. The results of the patients that started with 36 patients that had daytime and nocturnal symptoms, ended up that it went down to 2. So from 36 down to 2, ended up just with nocturnal symptoms. So a significant improvement. 48 patients reported better exercise tolerance. The forced expiratory volume, the lung volume, in the first, second forced vital capacity and peak expiratory flow percentage increased. So that is their lung capacity increased with treatment. The questionnaire also showed a significant improvement. The use of steroids decreased significantly as well. So overall, they concluded that treating with laser acupuncture seemed to be safe and effective in these asthmatic children. Okay, we're getting down to the end now. This was a really great article, and it was a concise review published in 2019. If you have a chance to read it, I highly recommend it. Now, laser acupuncture, now this is all from this article. Laser acupuncture may be preferred acupuncture modality depending on the patient population, perhaps geriatric or pediatric patients because they may be sensitive to needles. It's obviously non-invasive. It's pain-free. Of course, we all know that most of the time acupuncture is pain-free, but not always. And it's possibly can be associated with fewer side effects. In fact, there are no known side effects with laser therapy or laser acupuncture. The treatment length, generally speaking, of laser acupuncture is anywhere from 10 to 60 seconds. Of course, this would depend on the power and some other factors. And this obviously is a little bit shorter. When you're doing needle acupuncture, you're leaving the needles in for a much longer period of time. So you may be able to reduce overall the treatment time. In contrast to needle acupuncture, as I mentioned, laser acupuncture is non-invasive and may be a little bit more feasible for these young, I think I'm just repeating myself, sorry, young and elderly patients. The other thing is that patients don't feel any sensations with low-level laser typically, although they may feel something, they may report the odd sensation, but it's not typical. The non-invasive nature of laser acupuncture also minimizes the risk of adverse effects. We all know that if you do needle acupuncture, depending on the area that you're treating, like say on top of the traps, and if you're using a long needle, you may obviously be careful about the lung and perhaps puncture the lung or an organ. If you're using a long needle, there's of course risk of infection, bleeding complications, so on and so forth, that you won't have with laser acupuncture. And as I mentioned earlier, you can use it in areas that might be uncomfortable to needle, or smaller areas or around the ear that may be difficult to do as well. Now, some recommendations. This is coming from me and the research. So generally speaking, wavelengths for superficial acupuncture points, you're looking at red, usually 630 to 680. 660 seems to be the more standardized wavelength to use. For deeper acupuncture points, I'd recommend near-infrared wavelengths, 780 to 900. My preference is in the 800s, around 810 to 830. That penetrates the deepest. I'm not saying that, by the way, that's proven by research. Power, I'm not going to suggest you use anything lower than 50 milliwatts. There are systems out there that use 5 milliwatts, 10 milliwatts. I really don't think that's enough power. Maybe if it's on there for 20, 30, 40 minutes or something, but even then, I would prefer that you would use at least 50 milliwatts. If you looked at the research, most of it uses 50, if not up to 200 milliwatts, around that range. Treatment time is going to vary, but anywhere from 10 to 60 seconds per point, depending on your power and your wavelength. And pulsing, I haven't even mentioned about pulsing. So pulsing is when you flash the light out. And there are considerations for that. Our company and Dr. Khan, the founder of Meditech and Bioflex, has experimented with many different frequencies. And on a clinical note, we tend to find that lower frequencies are less stimulatory and higher frequencies have greater stimulatory effect. And there's different understanding of that. However, I always get asked about Noget's frequencies, and in fact, you can buy equipment that has it built in. You can set our equipment up for Noget's if you want. I'm not a personally big advocate of Noget's, and I'll tell you why. Is that I tend to look at the research, and I just don't see a lot out there on Noget's. I'm not saying there's not something to it. I just don't see a lot of research on it. And so fundamentally, it's more anecdotal than research-based. Of course, you're going to treat a traditional acupuncture points, as some of the research has shown. You may also choose to treat ashi points, or even anatomical points that relate to specific structures as well. I do recommend that when you're using a laser probe or a laser acupuncture device, you hold it perpendicular to the tissue, not at an angle, because you can lose some of the light to reflection. And you may also want to depress the probe, especially if you're trying to get for deeper acupuncture points as well. Wow, that was a lot of information. I got through it all, which is pretty awesome. So I'm going to go to questions now. If you have any questions, just let me know. Just as a little plug here, I do trainings once a month. I have a training next week on a Friday. It's a full day event, 9 a.m. Eastern Daylight Time to 4:30 p.m. In Toronto. If you are interested, you can go to our website and take that in. It's only $199. I think that's a pretty good deal. I also have one in December as well. Okay, let's get to the questions. Do you have a let's lots of questions here. So let me just get up here. Okay, so question from Pam. I'm assuming this does not involve use of any kind of array, but rather a probe. I think I've covered that in the lecture. Do you have a good reference point for acupuncture points schematics? That you can find online for sure. Okay, it doesn't look like there are many questions. So any suggestions of what to start with? I'm not really sure, Nicole, what you mean by that. If you want to add laser acupuncture and you don't know any acupuncture, I would start with ashi points, which are just tender points. Those are easy to figure out, which you should be treating anyhow. But then there's some very standardized acupuncture points like large intestine 4 for pain. That's on the thenar eminence. There's some standardized acupuncture points that are pretty easy to learn, but of course you should take some courses. And I'm not advocating a few courses allows you to do acupuncture. I'm basically saying that. I'm an acupuncturist. What kind of probes would be good to start? I'm going to suggest red and infrared laser probes to start, Nicole. That minimally has 50 milliwatts and preferably up to 2 to 3 to 400 milliwatts. Obviously, I'm preference to our equipment because we can change the power and the frequency of our probes. Many of the equipment that's out there that's cheaper, you can't. And I think that's really important as well. So you can reach out to me, Nicole, if you want a bit more information as well. My email is at david@bioflexlaser.com. Thanks very much, everyone, for joining me, and training next Friday. And then I'm going to list a whole new series of webinars for November in the next day or so. Take care, everyone. Have a great afternoon and stay safe.